Acitretin is a medication that belongs to the retinoid class and is derived from vitamin A. It is used in the treatment of certain skin conditions, particularly severe psoriasis. Acitretin works by affecting the growth and development of skin cells. Acitretin is indicated for the treatment of severe psoriasis in adults. How to use? Acitretin is taken orally in the form of capsules. The dosage is individualized based on the patient's weight, severity of the condition, and response to treatment. The typical starting dose is often 25 to 50 mg once daily with food. The dosage may be adjusted by a healthcare provider. Contraindications. Acitretin should not be used in the following cases: pregnancy or women of childbearing potential who are not using reliable contraception, severe liver or kidney disease, hypersensitivity or allergy to acitretin or other retinoids, concurrent use of tetracyclines due to the risk of increased intracranial pressure. Special instructions. Female patients of childbearing potential must use 2 reliable forms of contraception simultaneously before, during, and for at least 3 years after acitretin treatment. Avoid excessive alcohol intake during acitretin therapy due to the risk of increased levels of triglycerides. Regular monitoring of blood lipid levels, liver function, and other parameters may be required. Side effects. Common side effects of acitretin may include dryness of the skin and mucous membranes, peeling or scaling of the skin, photosensitivity, increased sensitivity to sunlight, changes in nail and hair growth, elevated blood lipid levels. Serious side effects can occur, and if you experience signs of liver dysfunction, vision changes, or severe skin reactions, seek immediate medical attention.